Here is a 40 years old male patient who has sustained injury to the hip leading to IT fracture caused by RTA, and now he has been posted for elective hip surgery. The patient has underwent IT fixation under spinal anesthesia with proximal femoral nailing. Post surgery, he has been subjected for suprainguinal fascia iliaca block under ultrasound guidance. So, under aseptic precautions, parts painted and draped. And sonocyte ultrasound has been kept ready. So, marking the following landmarks. Now, we will see the picture in the ultrasound. By using high frequency linear probe, so we will identify the particular structures on the ultrasound by placing the high frequency linear probe, whereas the probe is placed in such a way that the pointer is directed towards the coordinate position. By placing the probe on the ASIS, and that is anterior superior iliac spine, so that we can see on the monitor, that is the anterior superior iliac spine, where we can see on the monitor the hyperechoic structure, the white line which is seeing. So, following the anterior superior iliac spine, move the probe along the anterior inferior iliac spine is seen. So, focusing on the anterior inferior iliac spine, so we have marked the anterior inferior iliac spine. As we can see on the ultrasound, the anterior inferior iliac spine is traced on the monitor. That's the anterior inferior iliac spine. So that is the anterior inferior iliac spine exactly. Then, so adjusting the probe such a way that the iliacus muscle and the transverse abdominis and the sartorius making a bow tie appearance. So we can adjust the probe by moving craniocaudally. So we can see above the anterior inferior iliac spine, we can see the muscle which is the iliacus muscle, and lateral to that we can see the sartorius, and medial to that we can see the transverse abdominis. So here we can see the anterior inferior spine, iliacus muscle, and the transverse sartorius muscles to the lateral. The lateral side is the sartorius muscle, and in the medial side we have transverse abdominis, and slightly tilting the probe towards the umbilicus, we can focus the deep circumflex iliac artery. So here we can see a pulsating just above the iliacus muscle. We can see a pulsating artery which is DCIA, that is deep circumflex iliac artery. You can see the deep circumflex iliac artery. So just below the deep circumflex iliac artery, which serves as a good landmark, and the fascia iliaca is just below the deep circumflex iliac artery, where we are going to deposit the drug. So the anesthetist who is not involved in the study is preparing the drug for the block. The drug is being prepared and the solution is ready. After defining the landmark and the things, we have to go ahead with the needle insertion just above the inguinal ligament, marking just below the deep circumflex iliac artery. The needle is inserted along the in plane approach. As you can see, the needle is passing in the in plane and reaching just below the deep circumflex iliac artery. So after confirming negative aspiration, the drug is being injected just below the deep circumflex iliac artery, and the fascia is getting open and the drug is getting spread. As you can see, the opening of the fascia iliaca and the drug spread in the ESG. So the 40 ml of the study drug is being deposited in the fascia iliaca compartment. So once the drug is injected, the needle is taken out. You can see the needle, the path, and the drug is being the needle is removed and the drug is deposited under the fascia iliaca. We can see the drug along the fascia iliaca spreading towards the femoral nerve and the other branches. You can see the drug spread along the fascia iliacus and the drug is being deposited around the femoral nerve. So the bow tie appearance again with the labelings. You can see the labelings. Thank you. ಯಜಮಾನ್ರೆ ನೋವು ಕಡಿಮೆ ಆಯಿತಾ? ಎಷ್ಟು ಕಡಿಮೆ ಆಯಿತು ನೋವು? ₹1 ಎಷ್ಟು ಭಾಗ ಕಡಿಮೆ ಆಗಿದೆ? ಒಂದು 25% ಕಡಿಮೆ ಆಯಿತಾ? ಸರಿ, ಆಯಿತು. ಥ್ಯಾಂಕ್ ಯು.